Hello everyone and welcome to another episode of Ask Dr. Bob. Have some very interesting questions today. This individual wanted to know about toenail fungus, and I mentioned emulsified oregano. And they started to take it, but they're nursing and they wanted to know what is an option. So what I usually encourage our patients to do, our practice members, is to focus on first staying away from sugar, because fungus loves sugar. The emulsified oregano is a tremendous product, but for those of you that are breastfeeding, reprogram your diet to include more foods that would include sulfur. That would be eggs, onion, and garlic, because parasites and unwanted and unfriendly organisms do not like sulfur. Now I know that parasites are not a fungus. I'm just trying to help normalize colon structure, flora like we call it. No sugar. Fungus loves sugar and yeast. Dr. Bob, what do you recommend for Graves' disease? Well, first, I would always encourage you to have a TSH, a T3, a T4, and a TPO. Those blood tests help me create a plan. But I want you to know this, and I've never mentioned this before on a video. I had a practice member years ago that had hyperthyroid because of eating Hostess Twinkies. And he went off the Twinkies, and I am telling you, his high thyroid function disappeared. Dr. Bob, why would high potassium, salt, and proteins cause kidney problems? Well, they're putting a demand on the kidneys. You know, kidneys are a detoxifying organ. And I know that you can have imbalances, and a lot of times I see individuals have kidney challenges because of taking Tylenol and diuretics. So there's always bad effects to medications, and your liver and your kidneys are commonly impacted. We had somebody is having some issues with hepatitis and liver issues, and their liver enzymes are off, and they also had low albumin, which is a source of a protein that we do as a marker in blood tests. When somebody has low albumin in our practice, we use a product called Argizyme. From your history, obviously, your liver is your issue, and you really want to address that. What about the Marissa, which is very common today? What can you use to get rid of that? We use a product, and I personally take a product called the Agricep, 10 drops every day in 4 to 6 ounces of water. And we have many, actually we have just a lot of people that use it on a regular basis, and we just do not have issues with any type of foreign invasion. Dr. Bob, what is the best food or foods for iodine? Anything that would come from the ocean is going to be a source of it, iodine. But you have to really be careful today, because you know there's a lot of questions and controversy about the Pacific Ocean and what happened with the tsunami, etc. So keep that in mind whenever you're going to get any type of food from the ocean. And we had an individual that had a lot of things going on in their life with blood pressure issues and thyroid and a lot of digestive distress and being borderline diabetic. Let me just tell you a few things. If you have gas immediately after eating, I would think that it's possible that you could use a digestive enzyme. If you have gas 2 or 3 hours after eating, I would usually think liver gallbladder distress. That's really significant. Some of the other things you have going on, I would love to be able to help you. As you mentioned, having a fatty liver, you know, you may consider looking into the book I wrote on detoxification. Keep it simple. Focus on green vegetables. Cut back from fruit, because we're seeing more and more people have issues with their liver because of fruit. The last question was, somebody wanted to know about getting enough calcium. So there are different types of calcium. They wanted to know calcium in almonds. So I did some exact research for you. There's about 240 plus milligrams of calcium in a cup of almonds. So yes, there are calories in almonds. I don't really necessarily promote almonds. I'm not saying they're bad foods, but they could definitely be a great source of calcium. And so is kale and sesame seeds. Great source of calcium that you get from a plant source. Wonderful questions. You might want to watch this over again, because there's a lot of little details in there that will make a difference in your life. I'm Dr. Bob DeMaria.